Hello, my name is Jose Munoz, internal medicine resident at ACA Citrus Hospital. I'll be presenting a case report titled Anorectal Mucosal Melanoma presented with Innumerable Hepatic Metastases, a Therapeutic Challenge. Anorectal mucosal melanoma is very rare and highly aggressive. It accounts for less than 1% of all melanomas and around 1% of anorectal cancers. We tend to see this more in females than males, and it has a very poor prognosis, having a 5-year mortality around 85%. The diagnosis is often delayed due to non-specific symptoms that can mimic benign anorectal conditions. Because of its rarity and poor prognosis, there is no standardized management guidelines, and treatment decisions are typically individualized. We present a case of a female patient with no past medical history who presented to the emergency department due to abdominal pain, nausea, vomiting, jaundice, bilateral lower extremity edema, and rectal bleeding. She told me that the last time she saw a physician was 12 years ago because she stated that she was always very healthy. On admission, the hepatic enzymes show bilirubin, AST, and ALT high levels, as well as the lactic acid and metabolic acidosis. The hepatic enzymes continue to increase during the hospital course. We also got tumor markers, which was positive for CA19-9. Here, in figure 1, we can see the MRCP showing hepatomegaly with metastatic necrotic lesion throughout the liver. Due to the findings of the MRCP and the rectal bleeding, we consult gastroenterology, in which they did flexible sigmoidoscopy showing protruding ulcerated and indurated anorectal mass. It was a biopsy which revealed malignant melanoma, confirming on immunohistochemistry. We also further did liver biopsy, confirming stage 4 disease with anorectal lesion as presumed to be the primary. The patient was discharged and she went to the oncologist to seek treatment, but she returned to the hospital a couple of days after due to worsening of her symptoms. She developed hypotension episodes and was upgraded to the ICU, in which we placed a central line, and despite initiating vasopressors, she passed away. This case is very challenged because when she came to the emergency department, she was already in very advanced stages, so surgery was not an option. We consulted with her between comfort measurements such as hospice care or aggressive treatment such as immunotherapy, and she decided the second option. Although she went to the oncologist to start a conversation about treatment, immunotherapy, she wasn't able to get the first one due to worsening of her symptoms. So, in conclusion, anorectal mucosal melanoma carries a very poor prognosis. Due to its low incidence, there are very limited evidence-based guidelines to direct physicians toward the most effective approach. Multidisciplinary coordination is very essential. Throughout outcomes remain dismal, even the modern systemic therapies. Treatment plans shall be considered patient preference and focus on enhancing overall quality of life. This case underscores the need for early detection strategies and perhaps novel therapeutic approach in this rare malignancy. Thank you.